There are 10 to 15 devices installed with various alarms and alarm categories, which can be acknowledged partly centrally, but mostly only locally. As a result, the noise levels by the bedside and on the wards can sometimes be very high.
Noise in the intensive care unit is a major issue. For patients, silence is very important. Patients who cannot find restful sleep develop delirium more quickly, a state in which they can no longer clearly distinguish between dreams, thoughts, and reality.
With the Eichsfeld Hospital Heiligenstadt, we have an innovation project together, where for the first time we bring the so-called Silent ICU offering to a running intensive care unit. For us, Silent ICU describes a concept of safe alarm distribution. We have developed a system that reliably directs alarms into the hands of caregivers. Because this system is reliable, it is allowed to mute medical devices at the bedside.
The cooperation project with Dräger and ASCOM is a visionary project. We have an alarm management system where the alarms from ventilators are transferred to smartphones of nurses and doctors, and ultimately creating a silent ICU.
Alarms can now be specifically forwarded to the responsible caregiver, who can confirm receipt or request support with a simple click.
As a project specialist for connected systems, I face many challenges in the IT field. It's about providing networks and server systems and finding a common consensus with IT.
The SDC standard plays a significant role in this. SDC stands for Service-Oriented Device Connectivity, an IEEE standard, meaning an open standard for everyone. All devices in our distributed alarm system are connected via this standard.
Our hospital, the Eichsfeld Hospital, is at the forefront of digital transformation. We connect all medical devices and systems at our clinic to transfer data seamlessly between systems.
In addition to Dräger, the company ASCOM is involved in this project, and so the opportunity arose for multiple manufacturers to work together with us as clinicians, which, in my assessment, will sustainably improve intensive care medicine.
With the Silent ICU offering, we pursue two goals: reducing stress for caregivers and creating a healing environment for patients by primarily reducing noise in intensive care units.
By specifically distributing alarms to individual team members, the overall alarm burden for each individual is significantly reduced. Many alarms otherwise lead to alarm fatigue, meaning the individual alarm gets lost in the mass of alarms and may not receive full attention.
With full implementation, I expect a quieter ICU, leading to a calmer atmosphere for patients and staff. A lower noise level positively affects the well-being of everyone involved.
I believe Silent ICU is the right way to provide better support to our customers in caring for and recovering their patients.
Genesung der Patienten zu unterstützen.